Hey guys, I'm back outside. It's outside video weather again, and I could not be happier. So today I'm going to show you something that is, it's really different from what I have done on the channel normally. And this is, so full disclosure, this is the second time I'm recording this video, because the first time I just wasn't happy with the way it came out, and I don't feel like I properly expressed, probably showed kind of the product here. And I think I babbled a lot and went way too into my medical mumbo jumbo, and I wasn't happy with the video quality. So we're gonna do a take 2 on it, and plus now I get to do it outside. Today I'm going to be showing you something from a company called Jase Medical, and they call it the Jase case. And other full disclosure, this is something that I at first was not entirely sure I really even wanted to do a video on. I had to really mull it over after one of the representatives contacted me, because those of you who have been with the channel for a while know that with my past experience, career-wise and everything, I do take medical stuff really seriously, and I am always very careful with what I put out over this channel. And I weigh it very carefully, and I'll trust me, I'll get there in a minute. Why I kind of wrestled with whether or not I wanted to do this. And I'll just tell you, because it involves antibiotics for you to have on hand for disaster, medical, emergency, pandemic, survival, outdoor adventuring, whatever. And there was a part of me at first that thought, look, I want to make sure I really think about what it is that I'm kind of endorsing here and recommending, or even if I'm not recommending, that I'm even showing and introducing to you guys before I do it. Well, it's a medication, and I don't want to be perceived as giving medical advice when that's not what I'm doing, and there are details to it. But honestly, like for real, the more I hate when in videos when I say honestly, because I feel like that implies that up until that point I've been lying, but now honestly no. But the more I looked into it and the more I thought about it and looked at their service, I realized it's a good thing to have, especially considering some of the alternatives out there. And so I'm gonna get into what this is. So what this is an every antibiotic you could possibly need for any emergency scenario. And I want to make clear, I'm not advocating you should self-medicate and self-diagnose. Whenever there is an opportunity to seek professional medical advice, that is a key thing, and I always say this. But these include the very serious antibiotics that the military issues out for counter biological warfare, all the way down to the most common stuff you would get for like a sinus or respiratory infection. They give you everything in here. And they don't just hand you a bag of drugs and say, good luck, God bless, trying to kill yourself with it. It's actual, this is actual medical grade. This is like prescription. It is prescribed to you. We'll get to that. Actual pharmaceutical antibiotics that come to your door in the case. Now, why is this important to phrase it like that? Because there are a lot of catalogs where you can buy veterinary or like fish antibiotics. And here's the truth. When you buy, like, what do they call it? Like fishamycin, or like, doxycycline and stuff like that, you have no idea what you are actually buying. And I do understand the desire and the utility of having anti-infectives and antibiotics on hand. But I have always been leery when I see in catalogs of these companies that sell you, and they say right on there, I mean, it says on the warning labels, not for human use, not for human consumption, for animal use only. But they sell it for you to stockpile in your go bag, in your survival bunker, in your, in your whatever. They know what you're buying it for. But it is not controlled by any pharmaceutical group. It is not certified by USP. United States Pharmacopoeia, which is the watchdog group, which is the overall like industry group that looks at medication and make sure it's correct. That like when you take 250 milligrams of amoxicillin, you are taking 250 good milligrams of proper antibiotic amoxicillin. Sorry guys, I get very into my medical stuff when I do these videos. As I've been talking, I've been flipping through the CH Cadella's catalog. Every other month, it's either in this or in Bug K, those animal grade, antibiotics. It's not in there, but here's why keeping a good stock of anti-infective medications on hand is a good idea, important. And this is straight from any military medical training. If you look at the history of military casualties, of deaths, going all the way back, all the way back to medieval times, to ancient Roman times, to, the Greeks, the biggest killer on the battlefield has never been pointy objects, things on fire, things that explode, high velocity pieces of lead, things like that. It has been infection. It has been sickness, literal sickness, because like when you have, especially way back in the day, you have a bunch of troops living together in close quarters in crap conditions out in the field, germs spread like wildfire. And when you have wounds, open wounds, that don't get proper medical treatment, they will get infected. And Civil War is a great example. If you look at all the deaths in the Civil War, a fraction of those were due to actual combat action, killed on the battlefield. The vast majority of those guys that died because they either got sick and died, or their wounds got infected and festered, and they lingered on in field hospitals and stuff, and died. Painful, terrible deaths later. And when we started to introduce antibiotics and the availability of actual medical care into the back, like you watch that percentage drop till, I like to say my wars, we had the ability to get somebody up off the battlefield and to a combat support hospital in 30 to 45 minutes. We had the ability to put forward deployed medical personnel with them. Literally with them in the field. So we were able to cut that down, that death rate dramatically. But we just suffered a huge pandemic, which was due to viral, not bacterial. So I should say that antibiotics will not help you if you have a viral infection. Won't do it. Won't do anything for it. But viral infections can often open the pathway to bacterial opportunistic infections as well. So back to this nifty case. What these guys do, Jase Medical, is they don't just have you hand over money. I'll warn you guys, it's not cheap. You're not just gonna hand over $50. But they will actually set up an online consult with an MD who will take your medical history, who will collect conditions you have, family history you have, and importantly, medications you are taking, allergies you have, and will actually put together a case that is for you. And they are all prescribed to you. They're actually prescribed to you. So this isn't anything shifty under the table. That's why other companies have to sell you like veterinary medical supplies, because you can't just sell this to people. It's not controlled substance like narcotics, but it is not an over-the-counter kind of stuff, because we don't want antibiotics floating around and just too freely used. That can cause problems too. But they have, I believe, it is up to 7 different antibiotics that will come to you in this case. And it's a nice case. It has 2 big sections, okay? And we got elastic in here, and then we've got the front pouch, and then we open it up, and then inside, we got more bottles, another bottle, and then you've got this interior, and then there's Velcro, so you can actually, you can move this around, you can arrange it however you want. You don't have to keep the meds in this case. This is a good case for other stuff. You can make a nice little, car kind of first aid kit out of this case if you want it. But what you get is, just like if you went to a pharmacy and got a prescription, you get the whole printed paperwork all about your meds and everything. But you also get this cool quick reference guide, like this. There's no antibiotic that only treats one thing in the world. Many of them overlap. There are many kinds of bacteria that can be treated by multiple different antibiotics. Some are better than others. And again, some, like, so if you're allergic to penicillin, you can't take penicillin, but you can take something like Z-Pak, azithromycin. So, and that's why it's important to get the medical consult, so that you can you figure all that out. So mine, personally, let me tell you everything that can come in this kit. Because I didn't get everything because I have a medical history and I am taking meds daily. So what you could get is amoxicillin. Amoxicillin is very common. If you have kids who have ever had an ear infection or like a throat infection, ear, nose, throat, they even have eye drops for it. Amoxicillin, very common antibiotic, treats a lot of stuff. Azithromycin. This stuff is great for, and I'll tell you what, we used to give it out a lot for, a week after a fun weekend night out in the town, and somebody comes into the True Medical Clinic and they're having to pee, it hurts when they pee, and they're having all sorts of stuff. A Z-Pak wipes that kind of stuff out real quick, but it also handles a number of just common respiratory type stuff and everything too. I'm going to go over some more uses for some of these things as we go. Ciprofloxacin, again, that's a very kind of broad spectrum antibiotic, rather powerful. One of the things that we would pack up for potential biological warfare, if, back in the day, that we take. Doxycycline, anthrax, great against anthrax. Specifically, that was what we, military-wise, used to stock it for. But Doxy it's not the biggest gun in the arsenal, but it's a pretty powerful antibiotic and can treat a number of things. Fluconazole, I'm not as familiar with that, but I'm familiar with the term, and again, it's out there a lot. Some of these words, guys. Metronidazole. Again, I've heard of it. I'm gonna read in the book what it's good, what some of the most common uses are. I have never taken that in my life. Nitrofurantoin. Again, never taken it in my life. I don't think I've really heard of it too much. But ondansetron, I have taken it, and sulfamethoxazole, and it's mixed with trimethoprim. That's some heavy stuff too. So let's see, what do we got? 1, 2, 3, 4, 5, 6, 7, 8, 9. Total of 9 possible antibiotics that could come in this kit. Now I don't have all 9. I actually got, what do I have? I have one of the bottles of amoxicillin. I have 2 bottles of doxycycline. Now, I'll be honest, I'm losing no sleep over having 2 big solid bottles of doxycycline for emergency use, survival use. Good stuff. I have a bottle of Metro and a bottle of Cipro. Again, I'm very happy having a bottle of Cipro, and then I've got a Z-Pak. So I ended up with 1, 2, 3, 4, 5, 6 bottles and a box. Z-Pak is so easy. I'm just going to show you this, the way they have it organized. So you take 2 initially, and then you take 1 for like a day, and it wipes out so many infections. It's so good. It's interesting that it comes in the box like this because they call it this isn't called the Z, this isn't the name brand Z-Pak. But Zithromax is the actual name brand that comes in the Z-Pak. But that's why it comes in this box, because it's your whole course right there. So there are warning labels of like what you shouldn't mix with it and everything. And they go into give you some different uses. Now, I'm not gonna bore you with the whole thing, but they actually talk about some different kinds of infections and what can come from it. I'm just gonna give you an idea, okay? So the amoxicillin used to treat, and this is focused towards emergency stuff. Again, this is not all encompassing. You can look this up online for more uses. Bite wounds. You're out and about, animal or human, because a human being's mouth is way more filthy and disgusting than any animal out there. And they do get infected. So bite wounds, pneumonia, sinusitis, And again, like I said, very common for ear infections, eye infections, other kinds of things. Azithromycin can treat pneumonia, traveler's diarrhea. Why is diarrhea important? Diarrhea doesn't kill you. What kills you about diarrhea is the severe dehydration that you can end up suffering from the diarrhea. I mean, diarrhea is all kinds of no fun, right? But you can get very malnourished, and even worse, you can die in a matter of days from uncontrolled diarrhea from a bacterial infection if not treated. And urinary tract infection. And of course, it hurts when I pee. Cipro, used to treat anthrax exposure and infection, they say bioterror. Plague, bubonic plague, I forgot about that. Yeah, bubonic plague. That is one of the, so tularemia, anthrax, and bubonic plague are 3 of the most commonly synthesized bioterror weapons out in the world. There are other things that can be used, like those are, I mean, we're talking about like put into either animals or warheads to be used somewhere. But those are out there. So anthrax, plague, traveler's diarrhea. Oh, and then tularemia, bioterror. Doxy, used to treat anthrax, bites, plague, skin infections. So when we say skin infections, we mean like you cut yourself and then that wound gets infected, you know? Or you get an infectious material on your skin, like a bug bite that gets infected. That's important because that stuff can spread pretty quick. Now, that's different than rubbing some A&D ointment on it. That A&D ointment just stays on the surface, but when you get a subcutaneous infection, sorry, big medical word, subcutaneous is inside the fat layer of skin, under that top layer. That's when you need antibiotics. The A&D ointment, triple antibiotic ointment, that's not going to get in there and cure that for you. Tetanus, and then tularemia again. Fluconazole, well, it treats vaginal candidiasis. I'm not going to read the whole word, but it treats other stuff. And then your metro, bacterial vaginosis, diarrhea caused by Giardia, and C. diff. C. diff can be a terrible gastrointestinal infection. Giardiasis, tetanus, trichomoniasis, the nitro, urinary tract infections, ondansetron, nausea and vomiting. There is another name for that, and I can never remember it. They make one that it's a little minty and it melts under your tongue, and it doesn't do much for me, but I know people it's pretty good for. They usually very often give the ondansetron in conjunction with other medications that have the potential to make you nauseous. Because what's the point of like swallowing antibiotics if you might throw them up later? I just can't think of what it is. And then the sulfa, bite wounds and urinary tract infections. That's a pretty good list. Again, this is not all encompassing. These antibiotics treat more than that. And then throughout the rest of the book, you've got a table of contents where it goes more into depth about treating specific things with the medication and different things you need to know about pregnancy risks, how to take it, what if you're breastfeeding, other medication interactions, things like that. It's a pretty good guide. It's not the best guide, but in the moment it's pretty good. If you're serious about knowing this, I would recommend picking up not like a big doctor's medication guide, but they have nursing medication guides, which are actually way more complete, because I'll tell you, nurses have to know much more about drugs and how they affect the body than really doctors do, because the nurses are going to be the ones with the patient who have to recognize adverse reactions, interactions with other drugs. They have to like doctors write the prescriptions, but it's the nurse who gets in trouble if the doctor prescribes a screwed up amount and the nurse administers it. So they know, get a nursing drug recognition guide, and if you really want to know about drugs, they're pretty good. NANDA. So anyway, okay. So having this on hand can be, in many situations, a life-saving tool, as much as bleeding control or airway. It comes after those in terms of your priorities of treatment, but if you find yourself in a non-permissive or austere environment, this could save your life. It really could. And that's why at first I wrestled around with the idea of me discussing medication and talking about a medication product, but then I thought about the pros and cons, and yeah, this could save one of you guys' life out there. Let's talk about the price. It's expensive. It is. It's $259, but for that $259, you get the whole thing. It comes complete with the prescription, the shipping, the medication, the doctor's consult, and all that. And you know, there are going to be some people that say, well, that's way too expensive. But I'll tell you what, it actually beats the price if you go get, like, you know, a standard prescription reoccurring from a doctor, onesies and twosies, you know, to have these all on hand. You can think of it as a one-time expense for an insurance policy if you want. I'm not saying you should buy it. I'm not saying you have to buy it. I'm saying if you have the money for it, it's not a bad thing to add to your emergency collection. We have lots of, you know, fancy tools and knives and bags and gear. This is a really good thing to add to that. So, you know, I have a link in the video description, and it is one of those trackable affiliate links. So I don't have a discount code or anything, but, you know, if you choose to get it, you go through the link. It certainly looks good for me, tells the company that people that watch my channel are interested in their stuff, and that they're not wasting their time sending stuff here for me to show you. You know, so maybe I can show you more stuff in the future and things like that. I mean, so you can click that link, even if you just want to go check out the website and see, you know, what they say there, and start the process off. Of course, if you got, you know, I listen, I'd be an idiot if I didn't say there's a lot of people that know a lot more about this about medications and antibiotics and all this than me. If you're out there, I know you are out there, and you want to chime in the comments, please do, and, you know, share some edumacation and stuff like that. But the one thing I could say is, you know, if you're not willing or don't have the money to spend on the real medicine, cool. I would never put, you know, fish antibiotics down my own kid's throat. Don't buy that stuff that's unregulated, untested, and you have no idea what it's doing. You know, there's other options out there, but I think this is a great option to add to all your stuff. I really think it's a good idea. So, I will answer any questions I can. But really the best idea is just click the link and go to the website, and I'm sure they have, you know, frequently asked questions, or they have a contact form if you want to ask, you know, directly questions about it or stuff like that. Like, what do you think of having something like this in your kit? Do you think it's a good idea? Do you not think it's a good idea for people to be walking around with this, or do you like it? Do you not like it? Where are your thoughts on this? Anybody afraid to have this around? Like, you'd be afraid to have it to dose yourself with? I don't know. But anyway, I want to thank Jase for sending me the sample kit here, and letting me experience the whole process so that I can speak about it intelligently. It really is pretty easy. I'm going to keep this whole thing, you know, around, and, you know, God forbid, hope I never need it, but if I do, at least I feel good knowing I have it. So, thank you guys for watching. You are all absolutely awesome. I appreciate every single one of you, and I'll be back again real soon.